Imagine waking up on a stone slab, surrounded by people with sharp rocks, and no idea why there's pain in your skull. No anesthesia, no hospitals, just raw survival. This isn't fiction. It happened, and somehow it worked. Today we're uncovering the first surgery ever recorded, and why ancient people dared to open a human head. 7,000 years ago. If this blew your mind, hit that subscribe button and join us as we uncover more mind-bending moments from history. Because the past is full of stories that will leave you speechless. 7,000 years ago, long before scalpels, hospitals, or even writing, someone drilled a hole into a living human skull, and they survived. The discovery was made by archaeologists in France in 1978. It revealed that the wound was not only incredibly recent, but also still healing. This meant that the operation was performed on someone who was still alive. And it wasn't just any ordinary person either. This guy was a respected member of his community. If you fall down, you could cut yourself on rocks and dirt, get an infection and die. Well, according to experts, you might turn to someone like Vaso. It was so common. It's in fact that some researchers think it might have been a rite of passage. Other experts think it may have been used to treat illnesses. Some argue that it was done to relieve pressure in the skull, or to allow evil spirits to escape. The truth is, we just don't know. They managed to avoid hitting any of the major blood vessels in the brain. Their willingness to take risks and experiment with new ideas helped them survive and thrive in a dangerous world. And it's this spirit of innovation that has allowed humans to overcome countless obstacles throughout history. So next time you find yourself feeling a bit overwhelmed, just remember that our ancestors once drilled holes in each other's skulls, and they would have survived if they had been willing to take risks and try new things. And although they didn't have any antibiotics, they must have somehow kept the wound clean, because there's no evidence of infection. Experts believe that Vaso was a kind of shaman, or spiritual leader, who used his skills to heal people. Even today, we use powerful anesthesia to put patients to sleep during brain surgery. Without anesthesia, any movement by the patient would mean the operation would have to stop, and the patient would be at risk of dying from infection. That's why it's so shocking that these Neolithic people were not only willing to do it, but actually survived the experience. He might have been called upon to help cure an illness or injury with a ritual that involved bloodletting or maybe even trepanation. The process of drilling a hole into the skull. But the most amazing part of the discovery in France is that the patient survived. Not only did the medical procedure not kill him, but he lived long enough to be buried with great honor. This suggests that Vaso, or whoever performed the surgery, likely knew what they were doing. After all, very few people would have survived the ordeal. If you have a toothache, your only remedy is to pull out the tooth yourself. No dentist around. If anything serious happens to your brain, well, you're basically screwed. There's no neurosurgery around. As you can tell by the fine linen cloth that he was buried with, along with his prized possessions, including a ceramic vase and ornaments made of bone and stone, they were excavating a Neolithic burial site. When they uncovered the skull of a man who had clearly undergone a procedure known as a trepanation. And how on earth did they survive the procedure with no tools, no medicine, and absolutely no knowledge of things like sterilization, or even basic anatomy? Villages are just starting to pop up and farming has begun. Pottery and weaving have been invented. Stone tools are common, and ornaments and jewelry are popular. The oldest known surgical instrument, a crude bone saw, has been invented. But don't get too excited because it's just a piece of bone with a sharp edge. It looks nothing like a saw at all. To understand this shocking story, we need to travel back to the Neolithic era. More than 7,000 years ago, in a place that is now France, that's where a hole is drilled into the skull. But the real shock came when the team studied the edges of the hole. But why would ancient humans perform such a risky surgery? The year is 4900 BC, and our world is one of small nomadic tribes who hunt wild animals for food and raise their own livestock. Life is harsh though, and disease and injury are everywhere. So what do you do if something goes seriously wrong upstairs? We don't know much about the origins of trepanation, but archaeologists found evidence of the practice all over the world during the Neolithic era. What we do know is that the procedure itself was incredibly painful and dangerous. Researchers believe that the surgery was likely performed using a hollowed-out seashell or a stone tool, both of which would leave behind an egg-shaped hole in the skull. So while we may never know exactly why this surgery took place, what it was like, or even how they kept him awake, we do know that the person who drilled into his skull was incredibly skilled. Whatever the reason for the procedure, it's clear that the ancient humans were willing to try anything to save their own lives.